I want to talk to you today about our so-called EcoDonor egg program. Here at CHR, we have two very distinct donor egg programs. Our standard donor egg program we are discussing somewhere else. It's a routine program where you select amongst a large number of young donors who we have carefully selected out, and you choose your donor, and you then have a fresh cycle with the donor, and you have all the rights to that donor's eggs. In other words, you can choose how many of her eggs you want to purchase. The eggs that are not purchased in such a standard donor egg program are going into our EcoDonor egg program, because those eggs are frozen. They are cryopreserved right away. And those eggs are then available in batches of 5 eggs in the EcoDonor program at a comparatively greatly reduced cycle cost to the standard donor program. If we ask, in principle, what the differences are between the two programs, then the number one difference, and frankly the strongest motivation to go with an EcoDonor program, is cost. The cost is roughly half of the cost of a standard program. But there's obviously a price to pay for that. One, the choice of donors is smaller. What I mean by that is that in our standard donor egg program, we have close to 200 donors our patients can select from. In our EcoDonor program, the number is much smaller. It is the same donors. They're equally carefully selected because, as I explained before, the eggs in the frozen program, in the EcoDonor program, are the eggs that were left over from a cycle in the fresh program. So the quality of the donors, the quality of the eggs is the same, but the eggs are frozen. And frozen eggs, as we now know with great certainty, and our center has extensively published about this, based on national data, frozen eggs slightly reduce pregnancy chances in donor programs. So in other words, using eggs from a donor fresh will give you slightly higher pregnancy rates than using those same donor's eggs frozen. And that should not be a surprise, because in our opinion, fresh is always better than frozen, whether it is fresh sperm, whether it is fresh eggs, or whether it is fresh embryos. The pregnancy rates are always a little better. Our freezing has gotten much better over the last 10 years, and therefore the difference is not very big, but anybody who tells you that fresh and frozen are the same is really not telling the whole truth. The use of frozen eggs, in other words, our EcoDonor program, has, however, additional benefits to just being cheaper, lower costs. And the additional benefits are mostly practical. It's simply easier to do a donor cycle with frozen eggs, because all the timing that is so complicated to arrange between a fresh donor donating her eggs, having an egg retrieval, and adjusting the recipient's uterus to the donor cycle, all of that falls by the wayside. We can basically at any point thaw those frozen eggs out and transfer them. Let me conclude by telling you that if you want to do a donor egg cycle at CHR, you obviously also have the alternative of selecting donor eggs in one out of many newly established donor egg banks. There are now quite a number of those frozen egg banks, kind of in analogy to what has been in existence for many decades, frozen sperm banks. However, a word of caution, and that is There is a reason why we maintain our own frozen egg bank. And the reason, frankly, is that we trust ourselves more in selecting donors. That doesn't mean that there are not some donor egg banks out there that do an excellent job in selecting the donors, but we have also seen quite a number of cases where donor egg bank eggs gave very poor results in terms of survival after thawing, in terms of pregnancy rates, etc. So we will gladly work with donor eggs, with frozen donor eggs from an egg bank, but we obviously cannot give you the same guarantee about their quality as we can when it comes to our own frozen eggs.